Anywhere that a medication is involved, you really should have a pharmacist involved and really kind of leading that charge. I think that's pretty standard. Um, and so in value-based care, we strongly believe in two components. We believe in the quality of care has to be as equally weighed as the value or the cost component. And so when we're thinking about the quality aspect, a lot of the population health type measures that we look at hit upon things like diabetes, that hits upon heart failure, it hits upon depression. A lot of these categories are medication driven. So the therapies being driven by medications, it makes sense for pharmacists to be heavily involved in discussing, what we want to get out of the use of those medications. So making sure that we have A1Cs under control, making sure blood pressure is managed, and that adherence is a big item when it comes to depression and anxiety. So having a pharmacist involved for those measures and those discussions about what we want to get out of therapy is crucial. And from the cost component, there's really a lot of pharmacists can do when it comes to items like making sure there are discussions around alignment of the formularies. Medications, when it comes to interchanging medications, pharmacists are positioned very well to be able to say these two are clinically equal. We might be talking with the health system, and we can come to an agreement that, well, why don't we just align on this one medication if we think they're clinically equal, because this one shows better value from a cost standpoint. So really, both sides of the quality and the cost or the value are positioned for a pharmacist to address. When it comes to some of the challenges, oftentimes it's really a matter of relationships. I can't commend Brendan, who'll talk in a moment, any more than I have about building relationships. Oftentimes there's an adversarial relationship when you first start out when it comes to a payer and a provider, because we're used to kind of butting heads. But under these value arrangements, we can start out as a challenge trying to make sure we're all on the same page. And we've really found that those quality initiatives we can all wrap our hands around, because that's what we're looking for. And once we have that trust established, that challenge of are we all in it for the same reasons has been leveled out. That's when we can get into some more of the cost components that people are a little bit more touchy about. So I'd say that those are the main challenges that we see from a pharmacist perspective. So when I first came to Blue Cross of North Carolina, we had some value-based arrangements going on, but pharmacy wasn't heavily involved necessarily. We did some things kind of off the side of our desks. But when the company had, I don't want to call it an about face, but this moment where we had some leadership that said, this is our goal. Value-based arrangements is what we're going to. 100% of our population in the next so many years will be part of these arrangements. And it was a truly remarkable thing to see every corner of our company kind of shift and find that true north. And that true north is what we're looking for in let's make care much more affordable for our members through these cost initiatives. It's the only way we're going to be bending this curve. But let's make sure when we pull these cost levers, let's make sure that everyone's on board. It was so much more collaborative to see our major health systems say, yes, we want to do this with you. And then and we're incorporating in those elements of let's make care better as well. It's such a win-win situation. And to see major health systems and the major payer in North Carolina, which is Blue Cross of North Carolina, kind of come together and find a North Star. It was really inspiring for at least my career and I think many others within the company.